My name is Sally Curvin. I live in the Baltimore, Maryland area, specifically the Towson area. I'm married. My husband's name is John Baker. And I have one son who is 16 and driving, and his name is Henry. I am self-employed as well as my husband John. How I ended up with a hospital bill that I couldn't afford. It was actually a hospital bill for some surgery that my husband John had. Um, he chose to have bariatric surgery. And like with most health insurance plans these days, they all have deductibles. So I did know that there was going to be that we probably would end up being responsible for the deductible portion of the bill for his surgery. But they also, like a lot of hospitals do now, also added on a facility fee of like, over 400 was 400, $450. So with our deductible, we ended up with over $2,000 that we owed. And that's a little painful on our wallet. With us both being self-employed, it's kind of hard to know what your income's going to be from month to month because it does vary with being self-employed. It was definitely stressful to consider how we are going to manage paying for that bill. I would have to say that Dollar Four made it a lot more easy just to get through the whole process of filling out the financial aid. And I love that the website just pulls in the information from the hospital and you can fill it in and take breaks as you need. I sort of felt like I had a virtual advocate holding my hand working with Dollar Four because you guys helped break down the filling out the paperwork to try to get the financial aid, which is overwhelming no matter what hospital you go to. You guys would email and text and say, "Hey, have you heard anything from the hospital? If so, please log in and let us know." And you would want updates, which I thought was great. It was just really helpful. My husband John was like, "Hey, I got a message from my chart." He logged on, saw the letter, and he was just sort of like blank, blank, like, is this mean that it's forgiven? So you can see what you owe them. And it was zeroed out. There was nothing. And which was, I needed that. I needed like an actual, numbers there just to tell me for sure, you don't owe anything. And we were just in shock. We didn't expect that the entire bill was going to be forgiven and that the hospital was going to say, "You don't owe us anything." When you realize that you are in a huge pool of people that are in the same situation, I think that gives you more confidence to try to change your situation as well. And I just feel like there's so many more tools now than there ever were to help people get the help they need.